Hello darlings, welcome to another episode of Learning with Auntie Midwife. If you are new here, my name is Lydia, but everybody calls me Auntie Midwife. I am a midwife at the Kolebu Teaching Hospital, maternity OPD to be precise. So Auntie Midwife is basically a pregnancy and parenting vlog. So this is where to come for expert advice and information on everything pregnancy, labor, postpartum, newborn care, preconception care, family planning, parenting, and everything in between. I've got you. So if you have not hit the subscribe button yet, please do. And if you are already subscribed to this channel, thank you so much for the love and support. And please don't forget to turn on your notifications so you get notified each time I put up a new video. So without wasting much of your time, I want us to dive into today's topic. So today I want us to talk about what to expect on your first antenatal visit. So most women show up for antenatal visits unprepared. What do I mean by unprepared? It's like you tell them, you inform them about something they have to do or have to get, and they are just like they had no idea. So they give you all sorts of excuses. And simply the long and short of the story is that people do not know what to expect when they come for antenatal the first time, or what is expected of them when they visit the antenatal visit for the first time. So today we will be covering all that happens during one's antenatal visit. So on your first antenatal visit, your midwife is going to take your personal information. So this is where they ask you about your personal details, basically your name, your date of birth, your age, your address, what you do, your occupation, your marital status, your telephone number, and your educational level. And then they ask you same questions for your spouse as well. So we would want to know your spouse's name, his age, what he does for a living, where he lives, whether he lives with you or not, his educational level as well. And then another a very important part of getting your details is a name of a contact person, and this is someone to call during emergency. So this is who to call in case of any emergency. So we'd need you to give us a name of somebody and your relationship with the person, and then we take the person's telephone number, so it's easy for us to contact the person in case anything happens to you. Alright, and then from there we move on to the obstetric history. So at the obstetric history, what we do is we ask you questions about the number of pregnancies you've had, number of births that you've had, if you've had any incidents of abortions, whether they were induced by yourself or whether it was spontaneous. All right, from there we also ask you about any histories of miscarriages. Okay, so we move on to your previous pregnancies, which includes miscarriages. So basically we'd want to know the number of pregnancies you've had, and for each pregnancy we want to know the date of delivery of that child, or if it was if you lost that pregnancy, we want to know the date, and then we want to know the place of birth for that particular child, the date of birth, and the place of birth. So we want to know basically whether you delivered at the hospital or a health center or a CHIPS compound or in the house, okay, or any other place, we'd want to know. From there, we would ask you if you've had any problems during that particular pregnancy, and then after that, we'd ask you the gestational age at which the baby was born. So perhaps you were 39 weeks or 38 weeks. This part is just to know if your pregnancy, if you're able to carry your pregnancy to 10, if it was a 10 baby or a preterm baby. Okay, so from there we ask you the mode of delivery, and this is just to know whether you had a spontaneous vaginal delivery or an assisted vaginal delivery, that whether you were assisted with vacuum or forceps, okay, and then, or whether you had a cesarean section. And then we move on to the outcome of that delivery, and basically we want to know if it was a live birth, that is if you had a live baby, or it was a stillbirth, that is if your baby was dead upon delivery, or if you miscarried it. From there we move on to labor or postpartum complications. So we want to know if you had any complications during your labor, all right, whether you had any complications that during labor that needed immediate and emergency care or something, or that resulted the delivery into a cesarean section or something like that, or whether you had any complications during your postpartum. It could be postpartum hemorrhage where you might have bled a lot, or in case of labor complications, whether you had a retained placenta, an obstructed delivery, we would want to know. From there we ask you the sex of that particular child, whether it was a male or it was female, and then would want to know the birth weight of that child and the child's present health. It's very important for us to know how the child is doing. If that is, if you did not lose the child, how the child is doing currently, whether the child is in a good condition, a poor condition, or whether the child has died or something like that. So we ask you these questions for each pregnancy. So we start from your first pregnancy, and then your first pregnancy, then we go to the second pregnancy, then we do that for the number of pregnancies that you've had. We ask you these questions, and these are very important questions that we history that we need to take. It informs the kind of pregnancy that you will be having currently. Pregnancies tend to follow a particular sequence or something like that, so it's important to take these histories to know the kind of care that you require or that you need. So if you go to the antenatal clinic and your midwife is asking you these questions, don't get irritated. Have patience and answer in the best way that you can, and it's important that you answer these questions truthfully. Okay, some people might have had abortions, might have terminated pregnancies before, and when you ask them, I think perhaps they are shy or something and they don't want to tell you the truth. It's important to know that the midwife is not there to judge you or anything like that. All this information, the midwife is not inquisitive. The midwife just wants to know your history, or no. It's nothing of that sort. All the questions that are asked you at the antenatal clinic they are questions that will actually help your care provider to know what's supposed to be done for you, and what type of client or what type of pregnancy that you are going to be having. Or yes, so we better prepare for any complication or anything that might have that might pop up, okay, during your pregnancy. So the next thing that your midwife will ask you is about infant feeding, and basically we want to know if you breastfed your last child and whether you did exclusive breastfeeding, and if you did, how long you did it for, and then if you did not, what were your reasons why you could not, do the exclusive breastfeeding. And then we'll sum it all up by asking you how long you breastfed your baby. So whether you breastfed your baby for 1 year and a half or 2 years or a year, would definitely like to know. So the next set of questions that we would ask you is your medical and surgical history. And let's take the medical history. At the medical history, your midwife would ask you ask you about certain medical conditions like hypertension, heart disease, sickle cell disease, diabetes, epilepsy, HIV, asthma, respiratory disease, tuberculosis, mental illness. So your midwife is going to ask you if you have any of such conditions. If you do not, you say you do not have any of these conditions. If you do, you let us know, so we better prepare. We're in a better position to prepare for you in case anything pops up during the pregnancy related to any of these conditions. And then we'd also ask you if you have any allergies to any drug or any food. And then we ask you of your medical history. If you're currently on any medication, we would like to know. So it's important for you to let your midwife know if you are currently taking any medication at that particular point in your pregnancy. Alright, and then for the surgical history, basically we want to know if you've undergone any surgeries before. Yes, so if you've gone through probably a myomectomy, or you've had a previous cesarean section, or you've had any surgery at all, this is where to tell your midwife that you've had this surgery. They would ask you what year you had it and all that. You just take a history of that. So the next set of questions is the social risk factors. And social risk factors, we want to know if you take alcohol and whether you smoke. Okay, it's important to know if you consume alcohol or you smoke. As I said earlier, all these questions are questions to let us be really informed about your current state of health and to be in a better position to prepare for any risks that your lifestyle or whatever you've been predisposed to might pose to your pregnancy. So from there we move on to your family history, and the family history is just like that of the medical history for yourself. We ask you if there's any family history of hypertension, heart disease, sickle cell disease, diabetes, multiple pregnancies, if in your family you have twins, triplets, stuff like that. And then if there are any incidents of birth defects in your family, if there's anyone born in your family who has a birth defect, we would like to know. And then if there is any history of mental health disorder, we would also like to know. From there, your midwife is going to do a physical examination for you. For your first antenatal visit, it is important for your midwife to do a physical exam for you. So if you go visit the antenatal clinic for the first time and your midwife doesn't do that, you can alert your midwife because it's supposed to be done. And during your physical examination, your midwife basically wants to know your general condition, whether your general condition, your general appearance and all that, whether you look fine or anything like that. And then your midwife inspects your face to see if it's normal, if there's any puffiness, if there's anything, she would want to look out for that. And then your midwife is going to look at your neck and your head. Your neck, she's going to feel for your thyroid glands, if it's enlarged, if it's inflamed or something, she would want to know. And then your midwife is going to examine your breasts and in examining your breast, your midwife is just looking out for any lymph nodes, and if there's any lumps in your breast. I'm sorry, the lymph nodes is for the neck, yes. So at your breast, your midwife is looking out for any lumps or anything of the sort, or any discharge from your nipple, yes. So from there, your midwife is going to assess your abdomen and whether there's any scars. If there's any scars, is there a scar from a previous surgery or anything of the sort? And then your midwife is going to assess your heart as well. And on the heart, your midwife is looking out for whether your heart is beating well, okay? And then we move on to the lungs, and what your midwife is going to look out for is whether you are breathing well, or like normally, whether you're breathing normally. And then yes, so this are all parts of the physical things your midwife is going to look out for during a physical examination. So if you visit the antenatal clinic for the first time, make sure you have been examined properly by your midwife. And if your midwife wants to examine you, please don't shy away, don't refuse. It's important that she assesses you for the first time, so in case of any deviations from normal, we would be able to pick it up fast. Okay. The next stage is records of current pregnancy. So previously we spoke about your midwife taking your past obstetric history. So here your midwife is going to take history on your current pregnancy, and this is where your midwife would ask you about your last menstrual period. And in asking you the last menstrual period, she wants to know the first day your last menses started. So it's not actually the date it ended, but the day it actually started. So it's important to, as a woman of reproductive age, it's important to take note of your last menstrual periods, or simply LMP. So your midwife is going to ask you about that. And why is the LMP important? It is important because your midwife is going to use that to calculate your expected date of delivery. Okay, aside using the first scan to estimate your the dates you're going to deliver, the best surest way to calculate your expected date of delivery is by using your LMPs. And I am going to do a video on how to calculate your EDD from your last menstrual period to yourself. So look out for that in my subsequent videos. I am going to drop the link in this video anytime I do so. You can just click onto it and it takes you to that video. Yes, so let's continue. From your LMP, your midwife is going to calculate and tell you your expected date for delivery. And then your midwife is going to take your height, the measurement of your height. The midwife is going to weigh you and to know your weight, and then your midwife calculates your BMI, that's your body mass index, with the measurements of your height and your weight. So it's used to calculate your body mass index before 12 weeks. Okay, and then your midwife is going to ask you the type of contraception you used before this pregnancy. If you used any contraception, your midwife would want to know which contraception you used. So the next item, or the next stage, is investigations. On every woman's first antenatal visit, it's important, one of the important things that is done is to do blood work, and this is simply some lab investigations that are done. So your midwife would request for certain labs, like your blood group, your resource type, your hepatitis B status, your sickling status, whether you're sickle cell or not, your GSSPD status. And GSSPD is glucose 6-phosphate deficiency, so your midwife would request for that as well. And then your midwife is also going to request for syphilis test to be done and HIV test to be done, and then blood film for malaria So with that, and your midwife would also like to know your HB, that's your hemoglobin level. So it's going to be part of the lab investigations that are going to be requested. Other investigations that could be requested on your first visit urine routine exam, and then I think stool routine examination. Yes, so just bear in mind that on your first antenatal visit you are going to do certain labs. So when you're going to the hospital, you prepare yourself for such lab investigations. Yeah. From there, your midwife is going to record your findings, as in the BP checked, the weight checked. And your midwife is going to record it into your book. And then another thing that is going to be checked is your urine. And what we are trying to find out from your urine, we want to check if there's protein in your urine or there's sugar in your urine. And this is very important, because if there's protein in your urine, then it suggests that you might have a condition. Or yes, so they will be checking your urine, and then your midwife would listen to your fetal heart by use of the fetoscope. This is a fetoscope, so this is my personal fetoscope. So this is a fetal stethoscope. Okay, so the fetoscope your midwife is going to be using will be something that looks like this. So you basically lie down, and your midwife will use this. She will palpate your abdomen to locate your baby's back, and then your midwife is going to put this fetoscope on your abdomen and listen. It's a bit uncomfortable, but it's not anything painful, and it's not anything that keeps long. It's important to check your fetal heart rate, because it's the only way that your midwife is going to know if your fetus is doing well in utero. Okay, so your midwife is going to, before checking your fetal heart rate, your midwife is going to palpate your abdomen, and see the presentation of your baby, whether your baby is head is coming, is what's presenting, or whether it's breech. Okay, so at every visit your midwife does this. Yes, so normally on your first visit it's quite early in your pregnancy, so it's normal if your midwife is not able to hear your fetal heart rate by use of the fetoscope or the sonicate, which is the electronic type of this. Okay, so if your midwife is unable to listen to your fetal heart rate on your first visit, it's quite normal. It's actually normal, because at that stage in your pregnancy is quite early, and it's not easy to use the fetoscope to listen to the fetal heart, but it can be your fetal heart can be detected on scan though. Yes, so do not be alarmed if on your first visit your midwife is unable to listen to your fetal heart rate. It is normal. All right, it is normal. Yes, so your midwife is going to ask you whether you have any complaints. Okay, so this is where to tell your midwife all the complaints you have, everything that you've been experiencing that you feel is abnormal, and this is where to ask all the questions bugging your mind. Okay, this is where you really make good use of your midwife to allay on all your anxieties. All right, do not keep mute at this point. Go back home and be googling all sorts of things, and be anxious about unnecessary stuff. When you go, please be your own advocate. Talk to your midwife if you're having any challenges, if you're having any problems. Talk to your midwife about it, and your midwife is there for you, and she will listen to you, and she would help you solve your problems. If it's anything that is beyond her, she would refer you to see a doctor. Okay, so yes, when you go for your first visit, be comfortable and try to ask a lot of questions as much as you can. It's good for you. Okay, so I think this is basically it. After that, your midwife is going to give you a date for your next visit, and on this date you'll be required to bring the results of the labs that have been requested. So basically this is what happens on your first antenatal visit. There's not anything scary or anything, just that it's a bit time consuming because this is your first time and we need to get a lot of information from you. So please make sure you have patience. Try and have patience for your midwife and try to ask questions from your midwife as well. Yes, so this brings us to the end of today's video. As usual, if you have any questions or any topics you want me to talk about in my subsequent videos, please put them in the comment section below. Or if you want to talk to me personally or see me personally, I do consultations, and so you can reach me on antemedwife@gmail.com or on my social media handles, antemedwife on Instagram, and no underscores, and the auntie is AUNTIE, antemedwife separated on Facebook and on Twitter. And you can visit my website at www.antemedwife.com. So please do take care of yourself, share and like this video, and until next time, bye bye.